Dr. Cross, we are seeing several states pass legislation that not only restricts a woman's ability to have available to her all of the options, specifically options regarding pregnancy, termination, and abortion, but also in some cases criminalizes physicians for offering care, evidence-based care that is legal. Can you say a little bit about that? I know, of course, you live in Texas and we've seen the laws in Texas. Can you say a little bit about the impact to women who are marginalized and minoritized and frankly have less resources?
Yeah, absolutely. It definitely impacts women with less resources at a disproportionate rate, because by essentially banning abortion, they're not calling it that, but essentially that's what it is. Because by the time they come to the doctor, there's already, going to be a heartbeat at that point. And so by creating those laws and limiting that ability to be able to make that decision for themselves and for their pregnancy, now, women without resources don't have the ability to travel to another state to be able to have the procedure performed like women of, a multitude of resources. So it definitely disproportionately affects women of color and women from, a lower socioeconomic status. And so I think it's atrocious. I think it's horrible. And then criminalizing physicians for providing the care that, we train to be able to provide for patients, where we can't even, recommend that they go to a certain clinic. We can't even make that recommendation or assist in any kind of way, or else, you could be, fined. And then they also incentivize people for reporting physicians or reporting, transportation or anything like that to actually assist these women in getting the termination procedures performed. So I think it's horrible, and I think the climate that this has created is horrible, because now what you're seeing as a result, and what we're going to continue seeing, is women making, out of desperation, making choices to, have procedures performed by, people who are not physicians, or from clinics that are not, true, healthcare clinics that, back alley procedures, as if you will. And, that's going to, increase the septic abortions and all these different, complications that could result and affect their future fertility when they are ready to have children. So it's a big deal. It's a big deal here in Texas.
Well, thank you for weighing in on that. Certainly impacts all women, but we do need to make sure that we are looking at these issues through an equity lens, and the disproportionate impact that you noted needs to be elevated and amplified and discussed. So thank you.